Hi, my name is Mitch Ziegler. We're going to go over some training today that is, you hear this a lot, it's called core training. I'm going to talk a little bit about the anatomy of the core, what it means, what muscles are involved. We're going to kind of go through that real quickly. The talk that I'm giving you right now is the talk that I give all my patients when they're learning how to stabilize their core so they can do different exercises, or if they're having back pain, they're able to add that stability around their lumbar spine or their pelvis to decrease their pain, and so they can do a lot of functional activities. So the first thing you need to know is the muscles of the core. And three of them that we're going to focus on today. Number one is the transversus abdominis muscle. The fibers of the transversus run in this fashion. They run in a horizontal fashion. Okay? And then there's another muscle in the back, and these muscles attach from vertebrae to vertebrae, and they're called the multifidi. And lastly, the muscles of the bottom part of the pelvis, which are the pelvic floor muscles, those are also a part of the core. So when I'm working core, what I'm thinking is I'm working the transversus, I'm working my pelvic floor muscles, and I'm also working my multifidi muscles. Okay, those are when I think of core. Now, if we expand out, we can work more muscles that surround the core to help, but this is basically what we're doing when we train core, and I'll show you what we're doing. Okay, so the first thing I want you to understand is that there's a difference between contracting the rectus muscle and the transverse abdominis muscle. When I contract the rectus muscle, I am actually crunching down the muscle, and if you see my belly, it's already kind of chubby, but when I contract it, it kind of protrudes a little bit more, okay? But when I work my transversus, I actually pull my stomach in, my belly button in towards my spine, so I actually get skinny. I call it the skinny jean contraction, okay? So I'm explaining this, when you're putting your skinny jeans on, you gotta pull your belly in to get your pants up, okay? So you wanna pull that belly button in towards your spine to work the transversus, not contract your rectus, okay? So there's a difference between the two, okay? So another thing that's important to know is some things, just physics, and some reactions that happen naturally in the body, the reflexes. So when I go to bend forward, what happens is my guts want to fall forward. They want to fall towards the floor. So my transversus actually contracts to hold my guts in, okay? Then what happens is there's a big buildup of pressure towards my rear end, and now my guts want to come out my rear end. How about that? So now the pelvic floor contracts. So when you pull in your transversus, there's an automatic reflex contraction where the pelvic floor contracts at the same time. So these two muscles work together, or they're not just two muscles, but these muscle groups work together. Transversus contracts, that creates a pelvic floor contraction at the same time. So it creates this stability anterior and then posterior, or anterior and inferior. Then the multifidi muscles, they need to also contract at the same time. So all these, the reflex that I want you to know is when you pull your belly in, the pelvic floor contracts at the same time. It's important that that happens to keep your guts in, okay? So when I pull my transversus in, what happens is that muscle wraps around and hooks into something back here called the lumbodorsal fascia. It's a big triangle piece of fascia that's in your back, okay? And that's really tough and sturdy. So this muscle wraps around, it hooks into this big lumbodorsal fascia. When I pull my belly in, it tightens up the fascia and pulls it really tense and tight. So if you kind of look at this muscle that wraps around and hooks into this fascia, it actually looks like a weightlifting belt. It's the weightlifting belt God's given us, and it's important that we learn how to use it, and that's why I'm explaining this to you. So pulling the belly button in activates this, it tightens up the fascia, and now we've got this stability that wraps around this area here, okay? But now when I pull the belly button in, remember I said it contract the pelvic floor. When the pelvic floor contracts, the tailbone dives down, it goes in a downward direction. The tailbone is hooked intimately into this fascia too, and what it does is it actually pulls the fascia down like this. So now I've got a couple things going on. When I pull my belly in, it tightens up the fascia this way, and it also tightens up the fascia this way. So that's what the core is. That's how all the stability happens around your pelvis and around your waist. It's simply by pulling the belly in, it activates all this. So the first thing I tell my patients to do, the first thing I'll tell you to do, is that you need to learn how to do this. You need to learn how to pull your stomach, how to pull your belly button in and relax it. Pull it in, relax it. Pull it in, skinny yourself, relax it. Pull it in, relax it. You need to do 200 of these a day, okay? And you can do these when you're sitting, when you're lying down, when you're standing. You can do them when you're having a conversation. I'm doing them right now as I'm talking to you. So it doesn't really require, you can do them anywhere. You can do it at any time. So it's important to work this transversus to know how to get it to fire, to get it stronger. So that's one of the things I want you to work on. Working on 200 of these a day. Now, this also correlates into daily life. So when I'm going to bend over and pick something up, what better thing to do than to put on my weightlifting belt? Pull my belly in, that activates my weightlifting belt, and then I can go and I can bend over and I can lift something. Or if I'm going to twist, I can pull my weightlifting belt or put my weightlifting belt on by pulling my belly in, and now I can do any type of twist movements and know that my core is stabilized. If I'm going to keep my legs straight and bend straight over and pick up something, pulling my belly in. If I go into a squat position, pull my belly in and put my weightlifting belt on. If I'm in bed and I'm rolling over in bed, if I pull my belly button in, that stabilizes this area and then I can roll over. So by simply pulling your belly in, puts that weightlifting belt on, and then what that enables you to do is to do a lot of activities safely, having stability around your waist and into your pelvis into the lumbar spine. Okay, so it's important to do 200 of these contractions, pulling your belly in, relaxing a day, and it's important with almost all of your activities that you're doing that you pull your belly in when you do it. So another thing I want to add to this is if I'm doing arm curls and I need stability around here, so pull my belly in, get my weightlifting belt on, and do it when I do curls, when I do triceps, when I do lat pulls. Anytime you're doing an exercise, it's good to work on your core at the same time. But most importantly, when you're functioning at home, lifting your child up, those type of things, pull your belly in to activate that core too, okay? So 200 pull-ins, activate your core when you're doing functional activities, and that'll really work, give you the foundation for that core that you need. So I hope this helps. I hope that clarifies some things about the core training. I hope you enjoyed this video and I hope you use this. So thank you very much for watching.